And now I'm going to introduce, I actually have the privilege of introducing Dr. DuBois. Dr. Richard DuBois is an expert in infectious diseases. He had an active private practice for 42 years, which included Buffalo, New York, Vietnam, and Atlanta. He is the past president of the Medical Association of Atlanta, the Infectious Diseases Society of Georgia, and the Georgia Society of Internal Medicine. He was the medical director of a high security unit for the CDC. He was given the Award of Excellence in Teaching at the Atlanta Medical Center, where he was selected as the most valuable physician. He appears in the list of best doctors in America every year since 1994, and selected by his peers as the doctor they would choose if they themselves were sick with an infectious disease, including HIV. He was the chief of medicine at Atlanta Medical Center for 8 years until his retirement after being a staff member there for 36 years. So thank you, Dr. DuBois, for joining us tonight.
Great, Sandy. It's good to be here. Thanks for having me.
Yes. So how did you get involved with Juice Plus, and what helped you to decide to partner with the Juice Plus company?
Well, I got to Atlanta in 1968, and it was a pretty normal practice. It was consultative infectious diseases in the hospital and general internal medicine in the office. And then in 1980, along came HIV. My clicker is not working here.
Okay.
Honey, flashlight, please. Honey, I need a light. I need a light. Okay. Sorry.
Nope, no problem. Do you want me to call Jan?
No, we got it. We try it again.
Okay.
Still not working. I'll try the other port. It's easier with this remote.
Okay.
Then try it again. I'll be done. Okay. Do it with my finger. Until, well, it's frozen up. Oh, unfreeze it. My goodness.
Can you use your arrow button or just click on your computer?
That's what I'm trying to do, but it's frozen at this slide. I don't know what I've done here. Okay, we got some action. All right, see what happens. Okay. Okay. 1980, along came HIV, which startled the entire medical community, and in fact, the entire world, kind of like coronavirus is doing now, in a different situation, of course, but it was very, very hard. And during the 80s, I lost, some years I lost a patient every day, over 300 patients per year. So it was real tough. But what I learned from my patients was those who had the best nutrition did the best with their infection. And I didn't know anything about nutrition. So I started to learn about nutrition and recommend better nutrition for those patients. And then along 1995, along came Juice Plus, and I knew immediately this is what my patients needed. And they couldn't buy it in the store. And so in order to facilitate them getting Juice Plus, I went ahead and became a Juice Plus partner right from the beginning.
Okay, so that means 26 years ago, you were the first person to talk about the science behind Juice Plus. Now the science is long and strong. As a healthcare professional, what does the research mean to you?
It really is. It's everything. It's absolutely everything, because as a healthcare professional, you want to be sure that what you're talking about has integrity, and it's pretty clear from the list of universities that you see before you that have put their name and their reputation with Juice Plus to do the research that we're going to talk about tonight. So, and I want to emphasize the research is what we call gold standard research. And you can see it's not simple. It's very, it's long steps. It's randomized, controlled, double-blind, placebo-controlled, and it's ethical. That means we don't use animals. We don't do laboratory studies. All of our studies are on humans, clinical research. And when you have that kind of integrity behind you, you can put your reputation on the line and say, I endorse this product because of the integrity of the science behind it. And nobody's going to give you a hard time when that kind of backing is behind it. Now, that's 26 years of high quality research. We are the most thoroughly researched product of its kind in the world, with 41 published peer-reviewed medical manuscripts. Now, PubMed calculates an impact factor. An impact factor is how does your product impact the scientific literature, and how many times is the journals in which it's published referenced by other scientists in their publications. So the impact factor for a respectable drug is 10 to 15. And Juice Plus has an overwhelming impact factor of 138.53. And that is a universally accepted certificate of quality. So what we have, I just want to remind everybody that the Clinical Research Quick Reference Guide has been updated and is now available. And you can use this to show customers and other potential partners the integrity of our research. And it goes into the explanation of it. It talks about the Juice Plus Science Institute that I'll mention just a little bit later. So I want to emphasize that we never claim to treat or cure or prevent any recognized human disease. And what we do claim, and what our research is all about, is aspects of human physiology. Because not everybody has diabetes or AIDS or heart disease, but everybody has these aspects of physiology which we study. And we know that some of these aspects of physiology, if they're not controlled and treated properly, lead to disease. So this is an important part of our story.
Well, speaking of aspects of physiology, let's start with oxidative stress. What is it and what does it do to our bodies?
This is an important one. This is overwhelming. It's part and parcel of all human disease. It's part and parcel of human life. You have to breathe air and you have to metabolize nutrients, and it really goes on. And this is the New England Journal of Medicine in a review of oxidative stress. And they put this flow chart here of the processes involved. And I asked myself, how many chemical reactions occur in the body? And I didn't know, so I Googled it. And Google says there's 37, whatever that number is, per second in the human body. Now, every one of these is generating what we call free radicals. When you burn anything in the body, you generate sparks. When you burn anything, you generate sparks. In your body, you're burning sugar, fat, and carbohydrate, and they generate sparks known as free radicals. They do damage to everything they touch. Now, all of these boxes that you see are bad boxes. They do bad, and you don't want them, except for this one. Some of these products you can repair or get rid of, but most of them just flow right down. And Remember, this is New England Journal of Medicine, and the bottom line is aging, disease, and death. And you want to impact that bottom line, obviously. So how do you fight that? Well, oxidative stress needs antioxidants to neutralize these free radicals before they do damage. And your only source of antioxidants is whole plant food-based food. And it's, you can see here, tens of thousands of antioxidants are present in plants. And we need to eat those phytonutrients and antioxidants to help fight off oxidative stress. Well, as you know, Juice Plus is whole food, plant-based nutrition. And we have 16 studies that show Juice Plus reduces oxidative stress in the human body. Now, the FDA and the FTC require for us to make a claim, for anybody to make a claim about a product, it has to have 2 published manuscripts, peer-reviewed, that show efficacy. We've got 16 already, and we're continuing with our research. There's no question that Juice Plus reduces oxidative stress in the human body.
And that's good. Since February is Heart Month, can you talk about the aspects of physiology associated with cardiovascular health?
Sure. It's important because, as you know, cardiovascular disease is a major killer in North America. This study was done by cardiologists at the University of Maryland, and the cardiologists stopped every morning at this fast food restaurant across the street from their laboratory. They got their coffee and went to work. But they noticed every morning these men were, the same men were there every morning eating the same breakfast. And they looked at the breakfast and it contained 50 grams of fat. So they said, gentlemen, will you mind coming to our laboratory after your breakfast this morning? Well, that 50 grams of fat caused spasm of the blood vessels that lasted for up to 6 hours. Now, spasm of the blood vessels is not good because when you have spasms, they get tight and they won't let blood flow through it. So if you've got trouble with blood flow to your brain or to your heart and you have spasm, that's why so many strokes can occur after a big fat meal or heart attacks after a heavy meal. So they gave them Juice Plus for 28 days, the fruit and vegetable blends, and reduced that spasm by 62%. But when they added the vineyard blend, our berry blend, to the fruit and vegetables, they reduced the spasm by 98%. Now, I want to show you this graphically because it is really impressive. If you think that spasm of blood vessels is bad for your heart and your brain, and you look at this and see that you can reduce that spasm by 98%, that's pretty awesome. And I'm proud of this particular graph. So we're still talking about aspects of physiology with cardiovascular disease. This is LDL cholesterol. Most people say bad cholesterol. In it are probably 3,000 to 6,000 molecules of cholesterol. It's made in your liver. It cycles out to all of your cells. And here's what's supposed to happen in normal physiology. The cells all have receptors that bind to that LDL, bring it inside the cell. They metabolize it into hormones and fatty acids and cell membranes, other things that require lipid. The receptor goes back out, and any leftover cholesterol gets picked up by a scavenger molecule that takes it back to the liver. Now, when it goes back to the liver, it's excreted as bile into the intestinal tract, but it's no longer LDL. It's actually HDL when it goes back to the liver. And that's why HDL is referred to as the good cholesterol. So that's what's supposed to happen. But here's what happens in oxidative stress. This is a blood vessel wall, and you see the cholesterol molecules in gold there. They are under attack by a toxic molecule called homocysteine, also by those free radicals we mentioned earlier. And these toxic molecules oxidize the cholesterol, the LDL cholesterol, into big globs of rancid fat. Instead of one particle at a time, these cells are eating the globules of rancid fat because they're so toxic, trying to destroy them. So after a while, they become bloated into what's known as a foam cell. Well, and all these things at the bottom are very bad things in those boxes. This is what happens if it continues. The white blood cells only live for about a few hours, 4 to 6 hours, and they die. And when they die, they leave the cholesterol, the oxidized LDL, where it stands underneath the blood vessel lining, and it becomes very inflammatory. If this thing ruptures, it's a heart attack. So this is the chronic silent inflammation that can be measured and which Juice Plus has been shown to decrease. So these are the aspects of physiology associated with that's a bad echo. With cardiovascular wellness. And as you can see, Juice Plus has 34 studies showing a positive impact on all of those aspects of physiology. Now that's pretty powerful stuff, and we're proud of that.
Yes, we are, and that fits right in with February Heart Month. So what is another important body of Juice Plus research?
Well, I like to talk about the DNA damage. Okay. It is so important because DNA is the most fabulous molecule in the world. It's the reason that we're alive. You've actually got enough DNA in your body to go to the sun and back again several times. It's an amazing molecule, but it's subject to this oxidative stress. And as it turns out, this DNA of every cell of your body sustains damage 10,000 times a day. And all that damage has to be repaired because you cannot throw away your DNA. It's your code of life. So Juice Plus has 3 studies showing reduction of DNA damage in the human body. And you can see for some reason, the elderly people had more reduction than the middle age and about a little bit more than the young subjects. But we'll continue to study how Juice Plus impacts DNA, but it's really important to think that every time DNA is damaged, it's an opportunity for a mutation. 10,000 times a day in every cell of your body. You have to repair it. If you don't repair it, it's a mutation, and we know that that's bad, and Juice Plus reduces that damage by as much as 66%. So we're proud of that as well.
Dr. DuBois, I've been reading several magazines, and they all confirm that our genes are not necessarily our future. Would you please elaborate on that topic?
I'd be happy to. This is, as I say, our DNA. It's a remarkable molecule, the most important molecule in the universe. And as I say, we've got enough to stretch to the sun and back again and there. But the thing about our genes in our DNA is that we have 22,000 genes. Collectively, we call them the human genome. But they constitute less than 5% of the total DNA in each cell. So the other 95%, we used to call junk DNA. 60 years ago, when I was in medical school, we call it junk DNA because we didn't know what it did. But now we know it constitutes the epigenome. You've got your genome, and on top of your genome, you've got the epigenome. And the epigenome actually, people like to talk about switches, that it has switches. It actually has 4 million switches in the epigenome for only 22,000 genes. And it's really not switches that are on and off. It's reactions that either hide the gene so it cannot be expressed, or displays the gene so it will be expressed. And it can hide it a little bit or a whole lot. It can express it a little bit or a whole lot. So That's what the epigenome does. And the good news is you can change your epigenome. Your epigenome responds to choices you make. You cannot change your genome, but you can change your epigenome. So this is why you're talking about how the public is aware of this now. Why your DNA is not your destiny. The study of epigenetics reveals how choices you make change your genes and those of your children, because your epigenome is inherited right along with your genome. And the thing is, you can change your epigenome by the choices that you make. Now, 150 years ago, when Darwin's Origins of Species was published, 150 years later, National Geographic had this cover article about what he didn't know. And what he didn't know was epigenetics. And it's interesting, the article in here was written by Matt Ridley, who also wrote a very interesting book called The Red Queen from Alice in Wonderland. And he was a classmate or a research colleague, I guess, of Dr. Mitra Ray, and she introduced me to Matt Ridley. So this also made Time magazine. Annie Murphy Paul wrote this book, How the 9 Months Before Birth Shaped the Rest of Your Life. Talks about choices mother can make during the pregnancy that impact her baby for the rest of her life. Now, it's not just the choices during the pregnancy or that she makes, it's also the spouse. And it can be choices that the grandparents have made that are inherited right along this line. This is a book I believe every teenager should read, and it will give them some degree of understanding and respect, I believe. This is Dr. David Williams. You notice the mouse on his shoulder. It's a happy mouse because it has a cancer gene that causes cancer, but its mother was fed phytonutrients during the pregnancy, and the cancer gene has been turned off. And these mice will never develop that cancer because the gene has been turned off. So this Dr. David Williams says, one day pregnant women will be prescribed a dietary supplement that will protect their future children from cancer. It's not science fiction. I think it's where we're headed. Well, it is not a prescription. It is not a dietary supplement. It's been out there for 28 years, and many of us as Juice Plus partners have seen really healthy Juice Plus babies. So once again, New England Journal of Medicine, the most reputable medical journal in the world, says all of these diseases have epigenetic switches that can be actually changed before the baby's even born. But notice coronary heart disease is top of the list, and this is 13 years old. So there's a lot more changes that have occurred since then, a lot more diseases associated with it. So what we do know is that it's stress, and that can include chemical stress and radiation, and environmental stress, and all manner of stress, as well as bad nutrition that promote the bad genes and suppress the good genes. And it's known now with decades of research that it's nutrients from food more than anything else that help to modulate in a good fashion genomic function. And that's really, really important.
Well, we know that Juice Plus is plant-based nutrition with lots of phytonutrients. Does Juice Plus impact the epigenome?
It sure does. The Human Epigenome Project is a major priority for the National Institutes of Health because, once again, it's a modifiable risk factor that you can make changes to your future health. And this study was done at the University of Newcastle for 80 days. They looked at subjects and they impacted over 1,600 genes. They promoted over 1,000 genes that are beneficial and were good for the subjects, and downregulated almost 500 genes that were overactive and were going actually doing some harm, and it was good to downregulate those. Several genes were involved in lipogenesis, inflammation, energy, and insulin metabolism were changed beneficially by the Juice Plus intervention. So that's a lot of activity that the Juice Plus capsules were able to do. They actually decreased cholesterol by 7.4% and LDL cholesterol. TNF-alpha is an inflammatory cytokine that they decreased, lowered blood pressure, increased lean muscle mass, and decreased systemic inflammation. That's pretty important, but they recognize that a decrease of cholesterol of 7.4% is calculated to be the equivalent of a 20-pound weight loss and a 19% decrease in the risk of cardiovascular disease. So their conclusion, fruit and vegetable concentrate supplementation may be beneficial for improving the metabolic profile, thus reducing the risk of developing chronic inflammatory disease. Now, recognize we've known for decades, the more fruits and vegetables people consume, the less likely they are to die from any cause. This is the first time this statement has ever appeared in a peer-reviewed medical manuscript about a single product, and that product is Juice Plus. We're proud of that.
Amen. We know so many things are important for heart health, but is there anything more we can do from a nutrition standpoint?
Well, I think there is. So we have, this is from the American Heart Association. It just emphasized the impact. And you can get this from the American Heart Association, or I can send the slide to you, or so can Sandy. And up the top are the risk factors. I'm kind of going to gloss over those, but there's a heart attack or stroke every 25 seconds. Every 39 seconds, people have die from heart attacks and stroke. Every year, almost 1 million, 750,000 have their first attack, and every year, 500,000 people have a second heart attack. And you can lower your blood pressure by 50% if you will, and lower your blood pressure, and you can decrease the risk of stroke and heart disease by 50%. And they point out that 1 out of every 3 deaths is caused by heart disease and stroke. So that's the magnitude of the problem. And again, this slide is available from the American Heart Association, and either Sandy or I can send it to you. So we ask our customers, besides Juice Plus, what are you doing to maintain health and reduce the risk of disease? And the most frequent answer was an omega, either chia seed, flaxseed, krill oil, or fish oil. Well, our mantra is whole food, plant-based nutrition, minimally processed. So we came up with a plant-based omega blend using the seeds from pomegranate, raspberry, sunflower, tomato. We use the sea buckthorn berry, and we get our DHA and EPA from the same place the fish do, from algae. Only we control the algae growth and the environment in which it grows with no contaminants. So, and we kept with Mother Nature's balance and included all of the omegas, omega 3, 5, 6, 7, and 9, Mother Nature's balance. Now, what does that mean? The omega 3 index is a measure of DHA and EPA in our red blood cells. A desired omega 3 index for heart health is greater than 8%. The average American is less than 5%, 4 to 5%. Now, here's an amazing fact. If your omega 3 index is less than 4%, you are 10 times more likely to die sudden death from a cardiac death than if your omega 3 index is greater than 8. Now, that's striking. That's something that really should touch people. And the key is that we have proven that our omega blend achieves a heart healthy index in a study done in Austria. Healthy patients, now the red indicates the average American omega 3 index, and the blue is the heart healthy zone, the blue arrows I'm talking about. Now the blue bars are the control, the orange bars are the omega blend by itself, one capsule, Green bars are the trio and one capsule of the omega blend, and the gold bars are 2 omega blends. And you can see the fantastic increase that our omega blend does in the heart healthy range of the omega-3 index. And note especially that the trio enhances the absorption and utilization of the omega-3 blend, our omega blend, by increasing it, as you can see in that green bar.
Wow. Can you please give us just an overview of the rest of the Juice Plus research?
Yeah, here it is. Juice Plus is bioavailable. It means it really gets into your body. It doesn't pass right through your body. Protects your DNA, reduces oxidative stress, supports healthy inflammatory response, supports health during exercise and immune health, supports lung health in smokers, supports periodontal and skin health and appearance, improves metabolism in overweight boys, improves quality of life after oral surgery, supports multiple parameters of cardiovascular health, positively impacts gene expression, and achieves a heart healthy omega-3 index. Now, consider this, except for Juice Plus, there is nothing else in the world available anyplace with or without a prescription that has been shown, proven to do that for human physiology. We're proud of that, and our customers are proud of that as well.
I think that's my favorite slide. That's great. Thank you. So where are we headed in the future with Juice Plus?
Well, I think that's a great question because our future couldn't look brighter. This is Dr. Manfred Lamprecht. You see, he has 2 PhDs. He's a doctor of medical science as well as exercise physiology. He has been the director of our research for over 7 years now. And he, along with Juice Plus, are the co-founder, and he is the director of the Juice Plus Science Institute, which is founded with the mission of advancing plant-based nutrition. It's going to become the comprehensive source in all the world for research on plant-based nutrition. It'll be a research for the research and scientific communication resource. It's password protected in some areas for qualified Juice Plus partners, mainly healthcare professionals. And in addition to our other research that's ongoing, for several years now, we've been looking at cognitive decline, aging, inflammation, and more on cardiovascular physiology with our Juice Plus product. So these are long-term studies. And again, we're not treating definite recognized diseases. We're looking at aspects of physiology in humans. So think about it, 50 years of business, 28 years of Juice Plus with great research, 41 published manuscripts, an impact factor that is the envy of everything in the world. Nobody else that I know of has an impact factor like that. It's evidence-based, it's clinically proven, and we have the Institute, the Juice Plus Science Institute, working right alongside of our Juice Plus company, directed by an internationally recognized authority in nutrition and exercise physiology. And we're lucky to have healthcare professionals that can spread the word, that are partners of the Juice Plus family. I just put myself up there with humility to represent healthcare professionals, but there are several of us that are out there more than willing, without any sort of pay, to talk about the Juice Plus product, the Juice Plus research, and why people should be taking it. So I think that wraps it up.
That was great. Thank you. Everyone, I say I'm going to stop the recording.